Weak healthcare systems in many developing countries are characterized by underfunding, understaffing, and poor infrastructure, resulting in significant inequities in health service delivery. Rural and remote populations often face limited access to healthcare facilities, exacerbated by a severe shortage of healthcare workers, including doctors, nurses, and midwives. High out-of-pocket expenses further burden families, pushing many into poverty, while public health facilities frequently lack essential medicines. These challenges stem from low government expenditure on health, brain drain as healthcare workers migrate to developed nations, and inefficient healthcare delivery systems. Mental health disorders are a significant yet often neglected issue in developing countries, where stigma and a lack of resources prevent individuals from seeking help. Depression, anxiety, and PTSD are highly prevalent, especially in conflict-affected regions. Yet there is a severe shortage of mental health professionals and facilities to address these conditions. Social stigma further discourages individuals from accessing care, perpetuating the cycle of neglect. Contributing factors include poverty, unemployment, and violence, which exacerbate mental health challenges. Additionally, limited funding and inadequate focus on mental health and national health policies hinder effective intervention and support. Environmental health challenges pose severe risks in developing countries, with issues like air pollution, deforestation, and climate change significantly impacting public health. Indoor air pollution from biomass fuel use and outdoor pollution from industrialization lead to widespread respiratory illnesses. Climate change exacerbates these problems by increasing extreme weather events, threatening food security, and altering disease patterns. Rising temperatures have expanded the range of vector-borne diseases like malaria and dengue. These challenges are driven by poor environmental regulations, reliance on traditional cooking methods, and inadequate infrastructure to address climate risks. Infectious disease outbreaks and epidemics are significant challenges in developing countries, where weak surveillance systems and inadequate response mechanisms leave populations vulnerable. Epidemics of diseases like Ebola, cholera, and measles are common in resource-limited settings, while close contact with animals increases the risk of zoonotic diseases such as rabies and avian flu. Pandemics like COVID-19 have highlighted the disproportionate impact on developing countries due to fragile health systems. These issues are exacerbated by poor disease surveillance, a lack of robust monitoring, and insufficient emergency preparedness and response plans. Social determinants of health, including poverty, education, gender inequality, and political instability, play a critical role in exacerbating public health problems. Poverty limits access to essential resources such as nutritious food, clean water, and healthcare services, leaving vulnerable populations at greater risk of illness. Gender inequality further compounds these issues by restricting women's access to education, decision-making power, and healthcare, perpetuating cycles of poor health. Additionally, conflict and political instability disrupt healthcare systems, displace populations, and worsen health outcomes, creating long-term challenges for public health improvement. Public health problems in developing countries are often interconnected and stem from systemic issues such as poverty, weak healthcare systems, and poor infrastructure. Addressing these challenges requires multi-sectoral approaches, including strengthening healthcare systems, improving sanitation, addressing social determinants, and increasing global and local investments in health. By tackling these pressing issues, developing countries can improve population health and accelerate progress toward achieving Sustainable Development Goals (SDGs).